Hello everyone. I'm a cardiologist, and today I want to share with you a very important topic: high blood pressure and how we can control it with a healthy lifestyle. You might think blood pressure is just about numbers on a monitor, but behind those numbers are your heart, your brain, your kidneys, and your whole body. That's why this condition is something we need to take very seriously. Part 1. Understanding high blood pressure. High blood pressure is often called the silent killer. That's because most people don't feel any symptoms in the early stages. Everything seems normal until one day complications strike without warning. It could be a sudden stroke or a heart attack that makes you collapse at work. And many people only realize it when it's already too late. According to international standards, the ideal blood pressure is about 120/80 mmHg. If your readings are regularly at 140/90 mmHg or higher, that's hypertension. It sounds simple, but ignoring it can be extremely dangerous. Who's more likely to get high blood pressure? People over 40, those who are overweight, especially with belly fat, people who don't exercise, who smoke or drink a lot of alcohol. And if it runs in your family, your risk is much higher. The good news is, most of these risk factors can be controlled, and you, with your daily lifestyle, can change your future. Let's start with the food you eat every day. Part 2. Nutrition, the key to blood pressure control. Nutrition is the #1 factor. Research shows that by just changing your diet, blood pressure can drop by 4 to 10 mmHg. That's almost the same effect as taking one blood pressure pill. 1. Cut down on salt, the golden rule. Sodium in salt makes your body hold on to water, which raises pressure inside your blood vessels. The WHO recommends less than 5 grams of salt per day for adults. But in reality, many people consume double that amount. So start eating less salty foods. Cut back on soy sauce, instant noodles, pickled vegetables, and processed snacks. Instead, use natural seasonings like garlic, pepper, lemon, or herbs for flavor. 2. Eat plenty of vegetables and fruits. Veggies and fruits provide potassium, which balances sodium and lowers blood pressure. They also give you vitamins, fiber, and antioxidants that protect blood vessels. Aim for at least 400 grams of vegetables and 200 to 300 grams of fruit daily. For example, a meal with boiled greens, a light soup, plus a banana or orange for dessert. Simple, but powerful for your heart health. 3. Choose healthy fats. Limit animal fat, organ meats, chicken skin, and deep-fried foods. Go for fish rich in omega-3, olive oil, avocado, and nuts like walnuts and almonds. Good fats protect your vessels and also nourish your brain. 4. Control sugar and refined carbs. Too much sugar makes you gain weight quickly. It also increases the risk of diabetes, a dangerous partner of hypertension. So limit sodas, candies, and large portions of white rice. You can switch to brown rice, sweet potatoes, oats, or whole grain bread. They keep you full longer and help stabilize blood sugar. A smart choice for a healthy heart. 5. Lean protein. Protein is essential, but choose the clean sources. Fish, skinless chicken, tofu, and low-fat berry are great options. Avoid fatty red meats, especially processed ones like sausages or deli meats. 6. Limit alcohol and coffee. Heavy drinking can spike blood pressure within hours. As for coffee, keep it to just 1 small cup in the morning. If you can, it's best to cut back as much as possible. 7. Stay hydrated. Drink 1.5 to 2 liters of water daily. Don't replace it with sodas or energy drinks. Plain water is still the best and safest choice. 8. Follow the DASH diet. This eating plan was designed specifically for people with high blood pressure. It's full of vegetables, fruits, low-fat dairy, and whole grains. Low in salt and bad fats, and proven to reduce blood pressure within weeks. Part 3. Exercise, nature's medicine. Regular exercise works like a free blood pressure medicine. It can lower your blood pressure by 4 to 9 mmHg. Plus, it keeps you fit, flexible, and boosts your mood. You need at least 150 minutes of moderate exercise per week. That's like walking briskly for 30 minutes a day, 5 days a week. Something anyone can do, no matter their age. Besides walking, you can swim, cycle, do yoga, or light strength training. The key is to enjoy it and make it a habit. Turn movement into a joy, not a chore. Remember, start slowly, increase intensity step by step. Always warm up first and listen to your body. If you feel chest pain or shortness of breath, stop right away. Part 4. A healthy lifestyle. Beyond diet and exercise, lifestyle choices are just as crucial. High blood pressure isn't only about what you eat, it's also about how you live each day. 1. Quit smoking. Every cigarette tightens your blood vessels and raises blood pressure instantly. There is no safe level of smoking. If you quit today, your heart will thank you tomorrow. 2. Keep a healthy weight. Belly fat is the #1 enemy of blood pressure. Losing just 5 to 10% of your weight can make a huge difference. Combine smart eating with regular workouts. 3. Manage stress. Chronic stress makes your body release stress hormones non-stop. This speeds up your heart and raises blood pressure. So learning to relax is part of the treatment. Try 10 minutes of meditation daily, deep breathing, listening to calm music, or talking with loved ones. Don't carry your worries alone. A peaceful mind brings a healthy heart. 4. Get enough sleep. Sleeping less than 6 hours a night raises your risk of hypertension. Aim for 7 to 8 hours of quality sleep. Turn off phones and screens 30 minutes before bed to help your brain rest. 5. Monitor your blood pressure at home. A digital blood pressure monitor can be your best friend. Check it at the same time daily and record the results. Bring those numbers to your doctor for better treatment decisions. Part 6. Medication and doctor's care. Sometimes lifestyle changes alone aren't enough. Many people still need medication. Common ones include diuretics, ACE inhibitors, ARBs, and calcium channel blockers. The most important thing, never stop your meds on your own. Some patients quit when their readings look normal, but that can lead to a sudden stroke or heart attack. Stick to your doctor's plan and keep up with checkups. Your doctor will adjust doses to suit your needs. That's the safest way to protect your long-term health. Part 7. A healthy day in practice. Picture a day like this. Morning. You wake up early and walk for 20 minutes. Breakfast is oatmeal, low-fat milk, and an apple. A fresh, light, energetic start. Lunch. Brown rice with steamed fish, boiled vegetables, and a bowl of soup. A banana for dessert. Then a short 15 minutes rest. Afternoon. After work, you go for another 20 minutes of walking or cycling. Your body feels refreshed and stress melts away. Your mind is calmer and lighter. Dinner. A light salad, grilled chicken breast, and some fruit. Before bed, you listen to soft music and breathe deeply. And you go to sleep on time, giving your heart the rest it deserves. Simple habits like these, if practiced daily, can transform your blood pressure. Your health, your mood, and your quality of life will all improve. Conclusion. A message of hope. My friends, high blood pressure is not the end of the road. It's simply a reminder that we must care more about our bodies. And the good news is, we can absolutely control it. Every small change matters. Less salt, more veggies, a 20-minute walk, going to bed earlier. All these little steps add up to protect your heart for years to come. If you found this video helpful, please share it with your friends and family, because sometimes one simple piece of advice can save a life. Thank you for listening. I wish you health, happiness, and peace.